Hi guys, good afternoon. How are you all? So it's a very quick meet. We already, met recently on Friday, I think, right? Friday evening, we had a wonderful executive webinar on SaaS and clinical research. So today again, we are here with the seventh executive webinar from the Curio for all of you. That is on medical coding. Okay, that is on medical coding, the opportunities and all. So we'll not take your much time, 30 minutes. We'll tell you about the things. We'll tell you what are the opportunities and options in the field of medical coding. What is the exact use of medical coding, where you can apply it, what are the needs of the medical coding, what are the skills you need, what are the certifications, what are the international certifications. We'll talk about those all the things. Okay, is it no voice? Can anyone confirm if I'm audible or not, guys? Someone is right.
You're audible.
Audibles.
Audible, sir, audible.
Okay, so please, Adnan, please check your network. Maybe some problem, sometimes it happens. Yeah, please check your networks and reconnect. No worries, you can reconnect with us. Okay, so that's fine. So guys, we will be talking about medical coding. Okay, and before that we have talked about uh, a lot uh, about clinical research, SAS, and medical writing, pharmacovigilance, and everything. And upcoming two webinars are also fantastic on 14th and 19th. Those are on regulatory affairs. Okay, those are on regulatory affairs. So I would tell people to stop the video, please. Stop your videos so we can smoothly run the show for next 30-40 minutes. And guys, you'll get the certificate of this, but at the end, after filling the feedback form. Okay, so thank you very much again for joining this wonderful webinar, guys. Thank you very much. So see, I'll not take you to the very specialized webinar and all, or I mean specialized things, but I'll tell you one thing. Let me tell you first about the medical coding. That's important. Okay, there are 143 people. I'm very happy to see you guys, and it is very important. Good afternoon, everyone. Good afternoon, all again. So let me just share one thing and let me ask you a few questions. Okay, let me ask you a few questions before. What do you understand by medical coding, and how many of you are any pharmacy person? First of all, let me tell you who is eligible for the medical coding. Okay, so anyone, bachelor's, maybe B Pharm, PharmD, or any bachelor of the health science also, any bachelor, medical biotechnology, medical biochemistry, or normal biochemistry, normal BSc bachelors, they all are eligible for the medical coding, because medical coding is a kind of technical job. Okay, definitely it is a benefit if you have the pharmacy degree or medical degree. It's wonderful. If you have the medical degree or pharmacy degree, it is an additional advantage for all of you. Additional advantage for all of you. Why? Because you are aware of the medical terminology. You are aware, you are well versed with the anatomy and physiology and pharmacology. Okay. Medical coding is completely dependent on the medical terminology and anatomy. Okay, how? See, if you have any time worked in the hospital, or may not be worked in the hospital, you are admitted to the hospital. Let me tell you very frankly, if you have any time even hospitalized, you will see the bills, right? You will see the bills, and what you will see in the bills, you will see okay, charges. You will see the charges of, and you will see there are some codes. Okay, there are some codes for suppose you have done the liver function test, there are some codes. You have done some hemoglobin, there is a code for hemoglobin. You have done some, and you have heart attack, suppose you have myocardial infarction, there is a code ICD 1101 or ICD 1101.2, right? So this is what, this is international coding for diseases. Okay, ICD is, this is the disease code, and disease codes are being given based on the system. Okay, system means there is a different code for cardiovascular system. Cardiovascular system, there is a different code, ICD maybe. I'm not sure what exactly is this, but I know a minute, but I'll tell you what exactly this is looks like. ICD 11, suppose, is for cardiovascular diseases. Okay, in cardiovascular diseases, again, you will have a lot of things: myocardial infarction, heart failure, and you will have arrhythmias, right? In myocardial infarction also, there is anastomy, right? There is istomy, there is unstable angina, there is stable angina. In heart failure also, heart failure with preserved ejection fraction, reduced ejection fraction, or mid-range ejection fraction. In arrhythmias also, SVT, atrial flutter, atrial fibrillation, ventricular fibrillation. So these all comes under the 11. So how these are given? Like these are given ICD 11.1, 11.2, and under the MI also, if that is like ICD 11.1.1.1, like this. There are different codes for all the diseases, guys. There are different codes for all the diseases, and how these diseases are used, how these disease codes are useful where you will work. So medical coding is nothing but learning about these codes properly in the proper manner. Okay, learning about these codes, and this comes with the immense knowledge of medical terminology, immense knowledge of anatomy and physiology. Okay, and you see, we have learned this, but no, this is a complex thing. Let me tell you, this is a complex thing. Not only this, it includes the tests, it includes the biochemical investigation, it includes the radiology. Whatever you are doing, everything has a code. Okay, what is the use of that code? Use of that code is in research. Telemedicine. Okay, let me write where you can go for the jobs. First, telemedicine nowadays is very famous. Why I'm keeping telemedicine in the first phase? Because telemedicine is very important, and whoever is sitting at the another side of the phone, one side is the patient, another side, they will check what code is matching with the patient's symptoms or signs, what disease code is matching, and how much we have to charge according to the disease code. Okay, telemedicine, based on that, they will suggest the tests, they will suggest the medicines. So, telemedicine, it is very important to understand the medical coding. Okay, insurance companies, very important. When they come to the insurance companies, they check, they are well versed. Again, they need the people who are very much expert in the medical coding, because they have to match the entire history, they have to match the entire medical records, they have to check if the hospital has correctly put the medical codes or the ICD codes for the disease. They're asking for the correct code, they're asking the correct amount or not. Medical coding is required in insurance companies, telemedicine, research. Okay, and many companies, all the companies are nowadays, whoever is working in the field of manufacturing, in the field of patient care, hospitals, most of the things, they need the patient medical coder. Okay, medical coders. And yes, I believe in India it is right now blooming. Okay, sometimes back it was blooming in US. And one more thing, why India needs more medical coder, guys, let me tell you. You also can read it. This is very, there are many newses. US is well established, market for medical coders. US is well established market for the medical coders, but they get the medical coders from India. Most of their medical coders are work from home. Okay, medical coders are not needed to be there, okay, in the company. Usually they work from home, or they have the offices in India, and they are completing their task from India only. Okay, because they get the medical coders in India at the less price. They give the less salary than the in US, because they have to pay in INR, not in dollars. It's a big booming opportunity for all the people. and especially for the pharmacy people who are connected with me here, PharmD or BPharm, MPharm, they can join medical coding, and they can talk about it, they can learn about it. See, I'm not the expert of medical coding, I can tell you this much on. Okay, but I'll tell you, we have conducted one brilliant course on medical coding. We have started in the month of August. We have completed first batch, and today is the final exam for that batch, first batch. We had 120 students, and the course was amazingly taken by our wonderful speaker who we have today with us, Miss Charanjit ji. So we have Charanjit ji with us here. Okay, Mr. Ranjit Kaur, she is a medical coding trainer. Okay, and she is running multiple batches for medical coding. She will tell what are the international certifications, because I'm not knowing about them. I don't know what is international certifications, what are the certification types, but I can tell you, I can tell you before I, hand over to the Charanjit ji, I'll tell you what are the things. This is not, medical coders are not only one type medical coder. Medical coders are inpatient medical coder, they are different. Outpatient medical coders are different. Cardiology specialized medical coder are different. Surgery specialized medical coder are different. Nephrology specialized medical coder are different. There is a vast list for the medical coders. The list of jobs is a long list for the medical coders. Okay, and I invite all of you to visit us, to check our website also. We have this wonderful medical course. We are launching it today only for all of you. Okay, after the first batch, we are launching this second batch for all of you today only. Okay, let me just take you through that, and then I'll hand over the session to Charanjit ji, who will be taking care of all the aspects. She will be telling you, she will be taking 15-20 minutes for you, and she will be answering all the questions. We will be answering all your questions. So let me just share this. Let me tell you, this is our medical coding course, executive certificate in medical coding. This is a 4 months diploma. I mean, sorry, 4 months course, not diploma, executive certificate course, medical coding. This is the second batch. Okay, we are including ICDs. We are talking about this entire syllabus: basics of anatomy, physiology, medical coding terminologies, ICD-10, and CPT, and all things will be included in this. Okay, and you will get the certificate at the end, and the course price is just 2,999 rupees, guys. Okay, so I'll share the website link here, no worries. I'll now hand over this to Charanjit ji. Charanjit ji, over to you. Please, give some glance insights on the medical coding. Please open your mic, Charanjit.
Thanks, Ajit. Sandhya, you were asking something?
Everyone first, before otherwise, there'll be a disturbance. Guys, 1 second. Please, I apologize. Yes, Charanjit, please open your mic and please go ahead. Yes.
Thanks, Ajit, for giving me the opportunity. So, as you already covered most of the part for the medical coding, you already covered the type of the certification, and you already tell everyone what the medical coding is. So, I saw one question. Someone asked whether the ICD-10 CM is included or not. So, we will cover ICD-10 CM, CPT, SCPCS, and we will cover all the basic syllabus which you will get into the CPC certification. So, if you are preparing for the CPC certification under the APC, then we will cover the complete syllabus. We will provide you the marks as well as the assignments.
Yes, so we are additionally, I'll just add to this, we are preparing you for the certification also, and we'll give you the valid certificate for the industry. But other than that, if you are preparing for the international certifications, we'll give you all the mock test. Our mock tests are going on for our students also. We'll give you all the books and material additionally complementary with the course. Okay, you will get all the material additionally with that. So Charanjit ji, I would just want to ask, what are the career options and opportunities the students will get or the participants will get in the area of medical coding? If I left something, please enlighten us on this.
You already covered everything. Student will get the opportunity in the MNCs. There will be 2 weekly off in the MNCs, 2 weekly permanent off, as well as work from home opportunity. They can pursue any other course with the medical coding if they want to. And in the South India, North India, as well as in the Jaipur, there are bulk of company who are providing job to the medical coding. And yes, diploma of if person have the diploma of pharmacy, then they can pursue this course. If person have the bachelor in the pharmacy, then they can pursue this course. So everyone who have the life science graduation or non-life science graduation, they both can pursue this course.
Yes. Yes, and India has many MNCs right now, as I told you, and as Chiranjeev ji is telling, you will get a lot of scope in India. Right now, it is blooming. Okay. Yeah. Okay. So, okay, there is this question, guys. You can write your questions. We can take up the questions. I would like to make it interactive. Glory is asking, ma'am, can I know which place is better to do medical coding? Mean in which place we get more salary? Yes, Chiranjeev ji. Any idea on this?
You will get more salary in the North India as compared to the South.
As compared to the Bangalore, and yes, that I have even felt. I was talking to my friends. So the companies in Chennai and Bangalore, they pay literally less, and the CROs and other companies in North India, which are in Gurgaon and all, they are paying a little more salary than the north. I mean, than the south, part of India. No, I'll see. Asutosh, you are in the family first year. I'll not suggest you to go for it. See, we are not here to make the money and get the participants, at any cost. You are first year. First, you learn the basics, you learn the therapeutics, you learn the pharmacology, and all. From fourth year, I'll suggest if you are in third year or fourth year. If you're in fourth year, please you can join. But from the first year, you will not understand anything of medical coding, dear. Okay, please. I'll suggest you to first go through the entire syllabus and read whatever is given, and then you can do it. Sai Prasad is asking, can we get job during internship in PharmD? No, see, dear, that is, I also don't suggest anyone. Like internship is a specific internship is given for a specific purpose. One sec, I'll just keep my laptop on charging and come back. Yeah, so I was answering Sai Prasad question. See, internship is a given to you for a specific purpose to learn the practicals. Okay, in the farm D, or your internship is for a specific purpose, not for the jobs. I was telling day for yesterday also, farm D people, they feel, oh, we have given a lot of exams in last 4.5 years. We have done one project in fifth year. Now we are free to do whatever we want. No, dear. Why they have included 1 year? The people who have included 1 year internship, they are, I mean, this is a very brilliant idea. In the MBBS also they have internship. Internship is for some purpose. Internship means you will learn the practical. Every day go to the hospital. Every day see the patient files. Every day talk to the patient. Every day look into the new disease. Learn their pathology, learn their anatomy, learn their medicines, learn the pharmacotherapeutics, learn the prescription audit, learn the billings. See, internship is for the specific purpose. You don't have the tension of exams. Okay. You are free from exam in the internship. That means you have 1 year just to learn practicals. Okay. Don't think that you will do the jobs because you are free. Not at all. This is a year where you can learn the most, where you can learn the best practicals from the patients, from the hospitals. You can learn regulatory, you can learn research, you can learn prescriptions, you can learn therapeutics, you can learn pharmacology, you can learn anatomy, you can learn patient records, everything you can learn in the internship. So don't think about the jobs and all. I suggest you this. Can I know the company names? Uh, Company name, Chiranjeev, if you can just list out one or two names. We usually don't give the company names as we are also, coming from the company side, that could be conflict. But yes, Chiranjeev, if you can just list down one or two companies.
There are so many major companies who is hiring the freshers like Optum,
Optum.
UHG, and NJ.
Yes. I think, yeah, your mic is off, Charanjit. Yeah, Optum is there definitely. Second year B Farm, I think, can pursue. Okay. Okay, I'll take the next question by the time, so he'll come back. Can one work part-time in medical coding for international healthcare while residing in India? Absolutely. That's why I was telling. See, medical coding is nothing like that you have to be in the office or you have to be with the patient. They will send you the documents, you will review the documents, and you will write, you will find the codings, you will do the codings. Coding means you don't have to work on the like Python language, Java language, or nothing. Coding means you already have the list of codes. You just have to train yourself how to search the correct code, how to search the correct code in a different disease, what kind of things are going on. If you are specialized in cardiology, you will take care of the entire cardiology part only, cardiology disease only. See, there are thousands of the hospitals worldwide. There are thousands of the, I mean, millions of the hospitals worldwide, millions of the hospital in India. Every hospital needs that coding, ICD. They use ICD, right? For the cardiology, for the arthritis, for the diabetes, for the hypertension, everything, for the oncology. So why we are learning the medical coding when we have the medical coding book with us, ICDs? Because you have to train yourself to search the correct code within a timeline, within seconds. That is the purpose of learning medical coding. How to search the code. If you get a case, you will immediately tell, okay, this is the code for this case. If the person is coming with suppose chest pain, I'm telling you just the example, coming with chest pain and shortness of breath for 5 days, and he's coming to the doctor and doctor is writing the bill to the finance department, what will be the code? We'll say ICD 11, simple. Because you are knowing that, you have the knowledge of that. Understand? You have the knowledge of that. So work from home, I'll come back to work from home. Yes, medical coding has a lot of work from home opportunities, like medical writing. Yes, it is. There is a lot of work from home in the medical coding department or medical coding job opportunities. And in India, multiple companies are there, multiple, not only one, almost all the CROs, I'm telling you guys, most of the CROs. And there are specialized medical coding companies who take or who hire the medical coding personals, and then I'm telling departments, there are hundreds of the department, psychology, surgery, and physical health, community medicine, or microbiology, immunology, cancer. In cancer also there are different types, so everyone needs the specialized medical coders for their job in telemedicine, and in our insurance companies, in medical companies, in manufacturing, in wherever. Okay, care providers, all the care providers. And nowadays, I'm telling you, the new AI companies are coming into the market. Okay, I was just reading, just before this I was giving a read for 10 minutes. I was just like, okay, whenever I come, I prepare myself to talk. Okay, I don't come just like that to tell you something. I was reading that nowadays utilization of AI in medical coding is killing. You know, means it is not getting your jobs, but it is making you sharper and faster in the medical coding. Okay, and other than that, AI entrepreneurship. Okay, AI entrepreneurship means nowadays many startups are coming. I was just reading, many startups are coming with the help of AI in the field of medical coding. Okay, so they are also hiring the people who are trained medical coders to train their algorithms in AI. You understand what I'm saying? It's a big deal. It's a big deal. Maybe 5-10 years back, no one was knowing many medical coders. Okay, but nowadays, and I accept it. I accept it. You will start with 15-20,000 as a medical coder. Not, you will not get 50,000 or 1 lakh immediately. But once you are expert in the field, you can switch the companies, you can go to the good companies, you can go to the MNCs, big companies, and there is a lot of scope. Lot of scope. Okay, there is a big scope in the medical coding field. Okay, so yes, I think Dimple Verma, you got your answer. And what certificate courses are required? See, we are providing the certificate course, and you will get the certificate. With our trainings, you can join any company, but there are some specialized company, as I was talking about SAS. Okay, SAS. We were talking about SAS day 4 yesterday. SAS has the SAS university, and some companies they prefer only the people who have SAS certification with them. Okay. Similarly, in this field also, there is a specific lobby of the companies like top multinational companies. They just take the people with the certification. Okay. So what is that certification? How it gets? If Charanjit ji is here, I'll just ask Charan to give a glance on the certification, what exactly the certification is and how we can get it and from where we get it and what are the types of certification. Charanjit, can you hear me?
Yes, Ajit. I might have some internet connection, so if I'll lose, I will be trying little
No worries,
while.
no
Okay.
worries. Please go ahead.
So there is majorly two type of certification, CPC or CIC. CPC and CIC both are conducted by the AAPC, which is American Academy of the Professional Coders,
Yes,
and they provide you the internationally valid certification, which is valid in India as well as in the US. So
yes,
CPC is the basic certification for the medical coding, and CIC is for the inpatient certification, which is higher
yes,
level of the CPC. So at the beginning, you have to start with the CPC. Then after 2 years, you will go for the CIC.
yes. CPC and CIC. I have written even. Okay, so these are the certificates he's talking about, and you will get from APIC, that is American,
Academy of the
Acad
Professional Coder,
American
AAPC.
Academy of yes, medical professionals. Yes, so you will get these certifications from them, and we are also AAPC. Yes, we are preparing you for this also. If you want to go for the certifications, we are giving you the all MCQs, some 8,000 MCQs to prepare for that, all the material for that, and we are conducting multiple mock tests for you to prepare for this if you want. Okay, so we are training not only for the industry, but we are also training you for the AAPC certifications if you want. Okay, so another questions I'll take from here. Okay, let me take these questions. Oh, there are a lot of questions. I am family second year. Should I enroll? No, family second years. Please do not enroll now. Because you will not understand here, guys. After third year, you can enroll. Okay. I have completed my medical coding and got my international certificate by ABC, but there is no interviews. Can I know which month we get more interviews? That Charanjit can tell. If it is there, I don't think that there is a specific month for the more interviews. Charanjit, can you give some glance on that, please?
Yes, and hiring is based on the requirement. So it might be possible that you are at the location where currently is not the hiring. You can share your resume and we can try if we can find any job for you.
Yeah, absolutely. We can also, help. But see, if you are, what we say, if you are able to mobilize, please try to find out jobs all over India. Just don't stick to one place. Okay, just don't stick to one place. You will get the job for sure, but you have to just, if you are able to switch the location, that will be great. Okay, yeah, B Pharma people can join. Okay, and can one work part time in the medical coding for international healthcare while residing in India? I think I told you that you can work part time. I don't think there is a part time. There will be 8 hours job minimum. So part time I will not say, but work from home is perfectly possible. Okay. This is the online course. What we are providing is 100% online. Okay, Sai Kumar, you can join. Yes, you can join. This is 100% online. Hello, sir and ma'am. I am PharmD graduate and I had a master's in health information management. I was already exposed to ICD-10, CM, CPT, ICD-O. However, proper practice hasn't been made done. Can this course help me improve my coding skills? Definitely, it will help you, and it is best for you literally if I tell, because you are already exposed, so you will be pro in that. And in this course, we are conducting 20 classes, more than 1.5 hours every Sunday. Okay, this is Sunday program. We are conducting every Sunday 2 hours, 1.5 hours to 2 hours class, completely practical class on the books. We will provide you the soft copy of the material. So through that, you will be reading, you will be practicing with us. Okay, definitely. Yes. Any other questions, guys? Sir, I have completed BPharm right now. PharmD right now. I'm doing my job in Max Hospital, Saket. Sir, I want to learn how to make diagnosis. What should I do? See, making diagnosis, I think the coding will not help. Coding is a different thing. Making diagnosis, you can join our, other course. Right now, we have come up with the medical diagnosis course only. We have just recently launched the clinical diagnosis course. You can join that course is very, that is free course. Okay, that is free course. You can join that, Dr. Abdullah. Okay, you can join that course. That is for clinical diagnosis only, but medical coding will not help you with the diagnosis for sure. Okay, so I'll not misguide you. This course, medical coding, will not help you in the diagnosis part. Malot Srikant is asking, sir, can we understand the medical coding books without any coaching by reading books? Can we understand? See, understanding is different thing. You can understand people. There are many people who are brilliant, who are learning directly and cracking ISPCS also. It's not a big deal. That is not a big deal. It totally depends on your skills and totally depends on your ability. It totally depends on your intelligence. So I think you're asking this question rightly, but there are people who are doing without coaching also, right? Without tuitions, people are topping the schools. People are like getting the first rank in the schools and colleges. That's different thing. But yes, you can do that. You can do that without doing this. Okay, but always coaching and all these helps. This course is online. Which international course to? CPC exam will conducted by, yes, I think she has written answered the question here. AI will eventually take up jobs for coding? Not at all. I don't think it will take any job. It will be, see, if you are efficient, no AI can take your job in any field. Guys, I'm telling you, in any field, AI will not take any jobs from you. Okay, any jobs from you, it will not take. If you are efficient enough, AI is not going to take your jobs. Okay, because AI is the human made, guys. If you are, you have made the AI. People like us made the AI, right? AI will not take, definitely. Yes, he's writing, Chanjiji. Your certificate validity is for how much time? No, this is a lifetime validity certificate. This is a training certificate. This is not the certification. We are not giving any kind of certification. Remember, this is a training certificate that you have done the medical coding training from us. You took the medical coding training from us. That will be lifelong with you. Okay. So there is no validity from our certificate. We are not providing any kind of validity for our certificate. Our certificate is for lifelong because we are just giving you the training of medical coding. Okay. If you want specific certifications, that's different, as Chiranjiji was telling. Okay, that's the different part. But our certificate is a training certificate that you took the training from us in the medical coding field, and that is more than enough for the jobs. Okay. CPC, ISC, APC. Course is online. Yes. BPharm students can join. Course details. Okay, course details. Let me share here. One sec, guys. Hey, one sec, just one sec. I'll just share the link with you so you all can check and check the brochure and you can register for it from there only. Let me share this with you. If you are interested, you can just go through this. This is the link I have shared here. Curiosity.medical coding. This is our link, guys. This is our link. Okay, this is our link. You can just go through this. You will find all the brochure and all everything. Okay, I think I lost somewhere. Thank you for your reference, sir. Okay. Then some people said that pharmacovigilance sector has good growth than medical coding. Which is better, sir? See, I don't compare any, I don't compare any, subject or any sector. You know why? I believe in my interest. It always goes with your interest, where you are interested. Sometimes, definitely, you are interested in money, where you will get more money. But I believe more than that, you have to determine by yourself where you want to work, where you want to go, what exactly you want to. Okay, maybe the medical pharmacovigilance has more salary, or but pharmacovigilance has some challenges also. Pharmacovigilance is not for the basic science people. Pharmacovigilance is not for the nursing people. Pharmacovigilance is a determined field for the medical and pharmacy people who are very, very, very much aware of the therapeutics and medicine, their side effects, their everything. You understand? So every field has their challenges and has their benefits, right? It's all about you. What is your interest? How much you can do? How much? What is your ability? You understand my point? So that is important for you to choose the field. If I say go to pharmacovigilance, go to medical writing, no, not at all. I will not suggest you like which is better, which is not better. And who I am to suggest you who is which is better, which is not better. It is totally up to you. Okay. Yes, pharmacovigilance has the good growth, but medical coding is also blooming. Medical writing is blooming. Medical writing is wonderful job sector. There are a lot of sectors. Yeah, CDM, regulatory affairs. We are talking about medical coding today. See, it is totally up to you what you choose, what you go for it. Okay, I think validity we talked about. How to apply for CPC? First you get the training, and if you are well trained to write the CPC, that is the online website, AAPC website, you can go there and you can apply online. Unrelated question, is there an app of Curio? An app offer, is there any app for Curio? No, not right now, but this website is app based website, so you can just download this as a app also. Okay, and you can just download this as a app also, and you can directly operate from your phone. Okay, Devas. Sir, several courses like medical writing, pharmacovigilance have started in CliMed for this month. What about the next batch? When next batch will be started? Sir, may I know what are the other better affiliations for medical writing? Better affiliations means I don't understand. I will say, as a provider, as a course provider, I will say my course is the best course. Seriously, if you ask me what are the other better affiliations, I'll say my course is the best. And if you see my browser, you will see we have conducted 8 batches. Okay, so this question is literally irrelevant. The other affiliations, I'll say my course is the best because we are providing the quality. Our people are from the industry. Our people are from the top-notch industries like GSK, Epser, and Kyneps and Novartis. They are teaching you medical writing. Okay, but when you are asking about the next batch, we are never sure. Our last batch was started in September, and now after 5 months we are starting this batch. Okay, 4 months. After 4 months we are starting this batch, so we are not sure about the next batch, dear. Okay. Sir, we have not introduced to 4th SEM yet, means we have not introduced to pharmacology and others. So then see, if you are in the, as I'm telling, second year, you don't go for this course right now. Because you see, you will not understand. It is not about fees. I'll charge 3,000 rupees. What I'll get in 3,000 rupees? You will not understand anything, dear. I'll not misguide you here. Okay. So if you are in PharmD first year or second year, please do not join. Please do not join. Okay. Medical chemistry, 4 people can join. Okay. Now I'm opening because the questions are over. Now I'm opening. I'm unmuting everyone. If someone wants to answer, someone wants to ask the questions, please ask the questions, guys. I think Sandhya Reddy was raising the hand. Someone, if wants to talk or ask the questions, please ask. By the time I'll share the feedback form with you guys. Wait. One sec. And guys, don't leave. I want a picture, good picture. Okay. I want a good picture with all of you. So just don't leave. Wait, I'll come back. One sec. I'll just get the feedback form link. Okay.
Hello, Dr. Ajit Sarab here.
Hi,
Sorry, I got
Sarabji.
late.
That's okay. That's perfectly fine. I think I and Charanjit ji was here, so we have covered. Yes.
Yeah. So it is closed now.
Yeah, no problem. But people are asking, okay, I have a question for you, Sarabjit ji, if you have joined. People are asking which is good, medical writing, pharmacovigilance, or medical coding. I told, see, this don't ask me this question because I believe in the interest. Whatever is interested for you, you go for it. Now, if you want to add on something, please add on.
See, one part of the question you already answered, that it lot lies in their interest. Second is medical writing is the job for which, if you are ready to read a lot, then you can surely pick a medical writing. It's just like after 12 or 13 years of experience, I'm still reading. So you you have to invest a lot. So be sure for a medical writing. And for pharmacovigilance, if you have very strong knowledge of pharmacology, that is really going to help you. Now, medical coding, Charanjit can add, that what really need for that. So, and
Yes, absolutely.
and Dr. Jeet, one thing I tell the student honestly is that is the reason that we are launching courses in very economical price. The
Yes.
reason is you try everything,
Yeah, you try everything. Yeah,
you try
absolutely.
everything. So I tell you my story. When I joined initially, I'm taking 2 minutes, I'm sorry. Huh?
Yeah.
So I mean, initially I joined clinical research. Medical writing to me was alien. I thought I can't do this. I
Yes.
can't do this. So I joined operations. Yeah.
Yeah.
But there my boss was, she by default, she has to write protocol. She said, Sarabjit, please help me, to
Yeah.
write in protocol. So
Yeah.
I thought like, okay, I got a mentor. Then slowly I developed such a great interest in a medical writing. Initially, where I was worried, like it is not my thing. It is not, I can't be a medical writer.
Correct.
Later, it became one of my favorite things. So
Correct. Correct.
guys, put yourself on silent.
Guys, put your
So
yeah, like on
yeah.
it.
So it is, yeah. It is always test and try and test. You try, maybe you will find it good. This is the reason that our all courses are very economical, which
Yes.
will give you an opportunity to learn. Once you are in the field, you suppose you have taken a course of pharmacovigilance, then you have taken a course of medical writing, you will be able to evaluate which one is my calling, right?
Yes.
So that way it will help you to understand. Yes,
Yes.
please.
No, no, please go ahead, sir. Please go ahead.
Okay, so that's what I wanted to tell the students. Even after doing their job, maybe 2 years later, they think that let's try now medical writing. I have done with the medical coding, but all these fields are interconnected, Dr. Ajit.
Yes.
If you have experience in a pharmacovigilance, suppose you are joined as a pharmacovigilance. In a
Yes.
pharmacovigilance also, after down the line 2-3 years, you can also PV safety writer also. You know,
Absolutely.
so these fields are not different from each other. They are very much linked to each other. And knowledge that you have gained in one field is surely going to help you in another. Like when I was working in operation, later I joined Kinaps as a medical writer. I didn't join as a fresher. I joined as a senior medical writer.
Yes.
So my experience in a clinical operation helped me to get a job in as a medical writer. So
Right.
just wanted to tell, the story.
Yeah. No, and I can see, I would see, I'm just checking through the participants. I can see someone has written ACP Tasmia Khanum, and there are many people who are from the medical coding field. If you guys want to speak and tell something to our audience here today, I'll be privileged. We'll be privileged to host you. Anyone who wants to put on some comments like what is the job scope in India, how they can do, because we are also new into this field. We have expert Charanjit ji here with us, but I would like to listen more. I want to like I want to learn more from all of you. So I can see there are people who have already received some certificates. So if they want to put their views, please guys, you're most welcome. Anyone, don't hesitate, please. This is your platform, not mine. Okay, I'm just a moderator for all of you. Someone wants to put the comments on it, the people who are already in the medical coding field, who are expert of the medical coding field. If no, then we'll just take a picture and then I'll share the feedback form, guys. Okay, please open your cameras just for a second. If you are comfortable, whoever is comfortable, please open your camera. We'll take pictures. Guys, please take the pictures, some pictures. Cameras, just for a minute. Anyone? Guys, please open your cameras if you can. Oh, there are not many people happy on Sunday to open the cameras. Okay, I can see only few faces, but that's okay. Nice, Devas. That's okay. That's perfectly fine. Okay, thank you, guys. So let me share the feedback form with all of you. So you please fill the feedback form, and with that, I would like to thank everyone who has joined today, and I would like to take up all the questions. If you have questions, please email to us. Okay, our email ID is admissions@curio. Okay, I'm writing this. Please write your questions. Okay, because we are also exploring with you. Okay, we are also exploring with you. We will help you to any extent, I'm very sure. Okay, so this is our email ID and website I've already shared with you. You can just go and check out the website for the course. Okay, you can just you can just give a visit to the website. If you register or not, give a visit to the website. You will find many more courses are there which can be helpful to you. Okay, so feedback form I have shared, guys. Thank you very much. Please fill the feedback form, and I will again thank our expert here, Charanjit ji, and I would thank Sarabjit ji here. So yes, guys, thank you very much. Have a good day, have a good Sunday, and I'll see you in the next webinar on 14th. Okay, I think it is on regulatory affairs or CDM.
Thanks,
We'll be talking about. Thank you very much. Thank you, guys. Take
Thank you,
care.
everyone. Happy
Thank you,
weekend.
everyone.
Bye bye.
Thank you. Happy weekend,
Happy
guys. Thank
weekend.
you.
Bye.
मीटिंग में बाय फ्रेंड चले गए सर
Thank you so much.
अरे सर यहीं पे है. Thank you very much. मैं कहीं नहीं गया हूँ. I'm here.
Thank you, sir. Thank you, sir.
Thank you very much, guys. Thank you very much.
थैंक यू सर जी
Please fill the feedback form and don't ask me later. Okay, I'm sharing again and again. Don't ask me to the feedback form. If you want certificate, please fill the
అరే
feedback.
తమ్ముడు మైకాఫే చోటు
I don't understand Tamil, Telugu, and much languages. If you want to speak, please speak in English or Hindi.
Yo.
सुन लिया
ఏం కాదురా